I am going to hand it over to Jill, and she is going to talk with our guest, Kim, today and help us learn more about being a physician assistant.
Thank you, Candace. And actually, I am just going to hand it over to Kim to kind of give us a little bit of background of her career and of her schooling and those kinds of things. And then if you have any questions, feel free to put those in the chat, and then I will kind of get Kim in between and we will talk about those questions.
Awesome. Well, as I said, my name's Kim and I'm a physician assistant or PA, and I have been working for a long time. I started in 2002, which is crazy to say. It'll be 19 years. And I'm actually still basically doing a lot of the similar things that I did when I first got out of school. And I first started with a job in women's health. It was actually the last job that I wanted. I had gone to school in Madison, which at that time it was still an undergrad 4-year degree, but it's now a master's degree, pretty much predominantly throughout the country, although not everywhere, but that's the preferred degree for entry PAs. Anyway, so I graduated from school. I wanted to get back into my hometown area of Northeast Wisconsin. As a PA, you can work in pretty much every medical specialty that there is. There aren't really restrictions to that practice, but we are trained in what's called the medical model. So similar to physicians. So we can diagnose and treat and manage conditions. We can work in surgery. We can work in the hospital. Many PAs also do work in education and teaching. You can also work in administration and research. So what's exciting too is that PAs were developed by the military. And so there are many PAs who actually still do work in the military. In fact, many of the people who are officers in the Navy and the Air Force and Army and other branches of the armed services are PAs that work in medicine. So it's a great way to actually work as a PA, get trained as a PA, get your schooling paid for as a PA if you're interested in military service. Most of the people that are PAs though do work clinically. That's definitely a predominant focus. Most people become a PA because they want to take care of patients. The biggest difference for PAs in general versus other healthcare providers like nurse practitioners or medical doctors is where they kind of came from. If you're a nurse practitioner, then you were a nurse first. That's just the way that their training evolves. But there are PAs that were nurses before, and they may have chosen to go to PA school because our training is medically based. It's a little bit different than the nursing model. And we also have usually more training in surgical expertise. So if you are really interested in surgery, that is kind of where there are more PAs than there are nurse practitioners, but not necessarily. In many nurse practitioner schools, you'll focus on a particular area. You might be a family practice nurse practitioner and then go on to work in other specialties, but they also can subspecialize. Nurse practitioners can go to geriatric nurse practitioner school or psychiatric or pediatric, whereas PAs are all trained in the general medical model. And then many of us will go on and work in a specialty and get either on the job training, or there are also postgraduate fellowships. So then you might ask, well, what's the difference for a PA versus a doctor? Physicians go to school for medical school. So they have 4 years of medical school, and then they decide what they're interested in specializing, what area of focus. So they apply for a residency. So they may not get a residency that's their first choice, but they get matched. And so they go on to specialize in family practice or orthopedics or oncology or ENT or plastic surgery. And then they do their residency, and then many of them also a fellowship. So there's a lot more schooling versus a PA who has 4 years of undergrad, 2 to 3 years of graduate school, and then most PAs then begin working. But some do continue to do a fellowship, whether that's in emergency medicine. There's fellowships in other subspecialties too, but it's not a requirement of employment. We pass a national board exam and can practice in any setting where we're on a partnered team with often our physician counterparts. So PAs are different from physicians because we aren't really practicing necessarily on our own, in our own clinic, running our own show. Physicians could, although most of them don't. Most of them are also employed by a health system or a clinic or a hospital. And a physician would have that kind of top of the pyramid essential piece of a clinical model of taking care of a patient. Whereas a PA could be the top of the pyramid. I am often the primary care provider for women. I don't necessarily need to go talk to a physician or get their feedback or their support. But when I first came out of school, I definitely did. So if you're a boots on the ground, get to work, get to do things, it's a lot of what PAs do. But we are still part of a team. So if you're the person who's like, I'm okay with being part of a team and not being the top of my field and not necessarily specializing in my focus, I'm not passionate about pediatric oncology, for example. That's kind of like PAs. We're very flexible and adaptable, and we often do change specialties throughout our career. Whereas physicians pick a specialty, focus in on that area, and really get into the very, very fine details of knowledge. I'm not saying PAs don't do that too, but it's just a little bit of a different direction. And I think it's an important difference that people recognize. So sometimes that's a lot of young people, they're like, PA, great. Like I only have to go to school for this many more years. And then I can start working. But if you're the kind of person who is really looking to have that, you're an independent thinker, which I am, but don't get me wrong, but you're a very strongly independent thinker. You're a very passionate person about a specific piece of healthcare. Medical school very much might be where you want to be, because you might not be completely satisfied 10, 15 years into your career as a PA, because you're kind of like upward mobility might be at a certain level. But there are PAs who do upward mobility, get an administrative degree, get another, public health or administrative masters. Or in my world, I actually really enjoy teaching, and I enjoy using the electronic medical records. So I actually train people. That's what I'm doing today, and why I'm not in my clinic. I train other providers on how to use the electronic medical record, and I think it's fun. With COVID, I also was involved in training people who needed to go work in the hospital who weren't used to working in the hospital. So healthcare is an exciting place to work. I think if you're at all interested in healthcare, you should maybe think about, researching the specific pieces and parts that you're interested in. Shadowing is limited with COVID, but we're trying to expand that more and more with programs like this, and allow people to see what people do and really understand what fits your personality and your interests. But like I said, I was happily surprised that what I thought I was interested in just really wasn't it as I got older and more experience. But my day-to-day, I work Monday through Thursday. I have clinic hours, 8 to 5. I see an average of probably 20 to 21 patients a day. I get to be the primary care provider for many women. I have patients as young as 11, 12, all the way up to, I think my oldest patient now is 92. And it's a great, great place to work, but it's not always easy, and it's not always fun, and it's not always happy. And I probably talked too long, and I bet there are questions that are better than me just rambling on.
Kim, thank you. I just have a few questions. We can back up just a little bit more on the education. You talk about if you are interested in PAs as far as before you go to college, what kinds of things can you do in preparation of college? And then talk about possible degrees in college, because as a PA, that is a graduate degree. You need to have a 4-year college degree before you can apply to PA school. Can you just talk about those things?
Yeah, sure. So similarly to any kind of healthcare related field, if you're interested in something related to healthcare, it is never a bad idea to think about, whether you're in high school or college, thinking about getting some patient care experience. And I know, again, the world is more complicated, but I can guarantee that there are positions open and that they're really needing people who are willing to do things like CNA work. We even at Bellin, where I work, Bellin Hospital in Green Bay, are hiring high school and college kids to help with just some of the pieces of our intake. And as we're going to be starting the vaccine rollout. So just literally getting your foot in the door, getting some experience and exposure. Always good to emphasize the sciences, math, and psychology. Medical terminology is never a bad thing to learn. And then I think just any kind of opportunity you have to get to meet people and to listen. It was interesting that your skill that you were emphasizing today was patience. One of the hardest things to learn is when to talk and not talk. and when to just listen. Because if you do not listen, you will miss a lot of what the patient's trying to tell you. So in healthcare, listening is part of being patient and not wanting to just jump in with what you want to say, but being patient and letting them finish to tell their story. So high school, it's always a +2 to learn a foreign language. In Green Bay and Wisconsin, a lot of our metro areas, there's multiple languages and opportunities to then also help yourself get more involved and more marketable. And make yourself unique as you're applying to PA school. It's very competitive. So if you're thinking about applying in college, again, you're taking a lot of those science courses for your 4-year degree. So a lot of people do major in a science-based degree, whether that is something like, biology or chemistry or genetics or psychology. But I think it's not necessarily something you have to have, but it just makes sense because of the requirements, anatomy, physiology. Some programs are also looking at, what makes you unique. They want to see that you've made yourself a well-rounded person and wanting to experience other cultures and other types of people. So I am not encouraging people to just jack up their resume with things that aren't real. But if you're interested in learning about anything, it's really just you need to be willing to learn to become a PA, because you're going to have to learn a lot in a very short amount of time. We learn pretty much the majority of what they're packing into medical school in their first 2 years of curriculum. We pack into pretty much 12 to 15 months. So it's extremely fast paced. So the more you like to learn, the more you're able to learn. A PA school is going to see that, and it's just going to shine. So I think that people should look at that too, and not just focus on just the sciences, but how can I make myself stand out? One of my nephews recently got an interview. So one of the first steps when you're applying, obviously, is filling out all the applications and writing a letter and all of that stuff. But then once you hopefully get an interview, then that's the second phase to make the final cut. And it definitely, if you can get yourself to that interview and you're a personable person, that's awesome. But if you can have something on your application that makes you unique, you're going to stand out. Grades are important always, unfortunately or fortunately, depending on where you are, but it's really important that you show your passion and your interest in people.
Excellent. So we've got some questions that are just about kind of your typical workday, or you kind of already talked about your normal hours. Can you talk about like a PA's of a typical workday, and then also Kim, talk about the demand for PAs, and then how COVID-19 has changed the job demand?
Yeah. So I already mentioned kind of I'm a clinic-based PA, but I did used to work in surgery 1 full day a week. So as a surgical, what's called a first assistant. So if you think about a surgery and you've maybe seen pictures or video, there's often the patient who's, being cared for by an anesthesiologist. Then there is the surgeon, and then someone managing the tools to hand to the surgeon, but there's also a second person who looks like they're helping with the surgery. So that's the first assist. And that person is often a PA, not always, but is often a PA. A lot of PAs work as surgical first assist. So they're really working side by side as literally another set of hands for the surgeon, often helping to open the patient and close and put the patient back together. The majority of surgeons, as soon as they're done with the MAID surgery, they're out of the OR and on to the next thing. And the PA will often stay and get the patient put back together, help them get transferred out of anesthesia, take care of their hospital orders and such. In the robotic cases that I helped with, so if you've ever seen a robotic surgery, it's pretty cool. If you haven't, you can go on YouTube and look at Da Vinci robot. Lots of applications, but we would do hysterectomies that way, where we take the uterus, and instead of making a big incision in the belly, we actually make little incisions, use robotic instruments. So the surgeon's at the console, like a video game console, controlling these instruments in the patient's body. And then the first assist, which would have been me, is at the patient's bedside and actually exchanging the instruments, managing the robot and how it's attached and passing things in and out. It's pretty fun. If you like anything kind of hands-on and technical and you like video games, definitely check out robotic and laparoscopic surgery, because I bet your eyes and your hands are going to be much more coordinated for it. I have a friend who is a PA who's worked in orthopedics, urology, urgent care, and emergency room. And so some of that overlaps, but depending on where she's working for any given period of time, she might be in the clinic all day. She might be in the operating room all day. She might be going into the emergency room for a 12-hour shift or a 24-hour shift, even at the hospital. PAs work in pretty much every area of medicine. And so depending on how many hours and how dangerous the work is for the patient, the pay can vary widely too. So PAs, actually, we just came out with the US jobs reports, what is it? I forget who always does this jobs, like ranking of the best jobs in America. The PAs came in at number one in all jobs, not just healthcare jobs, which is interesting. And it's because of the demand. There's a huge demand. We're extremely cost effective. We make less than physicians, but we can do a lot of the same work. We're very marketable and flexible, and we tend to like our job, and it's a good return on investment for what you pay to go to school versus what your salary is. It's a very rewarding job, but it's not always easy. And COVID has definitely changed things. Healthcare has changed. We do a lot of this. Not necessarily Zoom, but through video portals. I have regular visits with patients for med checks. So if I'm treating their anxiety or their depression or something that I don't necessarily need to listen to their heart and lungs, we can do their visit through a video, like a chat. But I do actually think that COVID has highlighted some pluses and some negatives. My job usually wasn't a 24/7, but I have to check results every day, because if I'm a primary care provider, I have to manage my patients when they have COVID, if they're at home. So if you have a positive test for COVID, which I'm guessing some of you may have, you probably did get a call from someone, often a nurse, making sure you're doing okay. But some of our patients who are kind of on the edge of they might need to go in, often they'll give that to a provider like a PA or a physician or a nurse practitioner. And then we'll do a video visit or a phone. And that could be on a Saturday or a Sunday. So COVID has a little bit affected my flexibility and work-life balance, but it's important for me to feel that I'm not abandoning people. It's a scary time. Getting the vaccine, I hope many of you are able to get the vaccine soon, although most of you are young people and probably not on the high priority list yet. But yeah, it's an interesting time. It's an exciting, scary, stressful, anxiety-producing time for everybody in healthcare.
Thank you. Is this job physically demanding? And then a question from a student, like, what happens if you're not comfortable with kind of the blood and maybe the bodily fluids? Like, is it something you get used to? Is it something that you can move away from? So talk about kind of how physically demanding your job is and what happens if you're not stood around, blood and needles and guts and stuff.
Yeah. So I can say, as far as the physically demanding job, some PAs have very physically demanding jobs. A spine surgery PA, a spine surgeon, anyone who works in spine surgery, they are standing for very long cases. Neurosurgery is dangerous to the patient. It's almost microscopic, essentially. They use these microscopes that extend up to the standing height. And they're looking through that view for hours like this, So it can be physically demanding because of how still you have to be for how long in one place. And some orthopedic surgery positions too, that's a lot of force that's needing to be utilized. You literally dislocate a hip when you're doing a hip replacement. Often it's very physical, long hours, maybe some sleep deprivation, depending on what role you have. But if you're a person who, you look at that and you're like, that's limiting to me, that doesn't sound good. I mean, there are roles that can work around that. I mean, obviously, there are PAs who do telemedicine. So they literally do this all day. So you could see where that would not be physically demanding at all, just probably more mentally and emotionally demanding. As far as the blood and guts, yeah. So it's a reality of healthcare that at some point, it'd be pretty rare. But if you're going to do direct patient contact, you're going to have to, I don't want to say get used to it, but be experiencing it. However, I will say, and I will admit to this and tell you, don't let it stop you. My very first shadowing experience, I signed up to shadow a PA, and I was super nervous. I had to meet her at the hospital at 5 a.m. to round on patients. She was a cardiothoracic PA, and I found out later had a reputation to not be the nicest person to students. She was a tough love kind of person, which wasn't a bad thing or good thing. It stressed me out. So I was nervous, hadn't eaten, And the very first thing I saw was, I won't get into detail, but it was one of the most disgusting things I've still ever seen. And I've seen disgusting things. And I went from a standing position to a horizontal position. And let's just say I ended up unconscious and embarrassed and woke up in the emergency room with her standing over my face saying, you should rethink your career. It's not for you. And I went back to my apartment, and my roommate was like, what happened? And to this day, we joke that we're each other's best advocate. She said, don't let one person stop you, try something different. And so then I shadowed a PA in a clinic, which is a little less gross, and just kind of eased my way in. So you don't always have to just rip the Band-Aid off. And feel like, oh, nobody's naturally a blood and guts person, or I should say rarely. So don't sell yourself short. But it is true that it does, you have to touch people at some point, even if all you do is gross anatomy and the patient has donated their body to science. Gross anatomy is part of a PA's training, which it seems like impossible to do, but they ease you in. There's no hazing, there's no throw you in the pool at the deep end. They ease people in, but it is something that you want to explore. You want to see, am I comfortable taking care of people? Am I comfortable talking to people? People tell you things that are incredibly personal, gut wrenching, emotionally draining, and sad. And that's probably the way harder thing than the blood and guts. Blood and guts you get used to.
Kim, that is an excellent answer. And thank you so much for sharing that story, because I do think sometimes people get a little unnerved with that. If they are not comfortable with that, they can certainly shy away. And so I appreciate your candidness on that, because not a lot of people would want to admit those kinds of things. Students do have a few more questions, but I also want you to kind of ponder, what is your kind of favorite thing about your job, or something that you maybe enjoy? Let's not do favorite. What's the thing that you enjoy the most about your job, but also enjoy the least?
Yeah, I enjoy the most feeling like a part of somebody's journey and story and sharing. I like to read historical fiction. And I'd like to think that what I do as a PA is live along with people's story of living fiction, living historical reality. I guess that's not fiction. I just enjoy people's stories. Everybody has a story. So even that person who comes into my office who's angry and yells at the front desk, and everyone's like, oh boy, you better watch out. She's not very nice. You're like, okay, well, guess what? There's a reason she's not very nice. You learn a lot about people, and it makes you really grateful to be in that role. It's such a gift to have, you walk into the room, you're walking into somebody's heart and soul. And even though they may just be there because they have a headache or their throat hurts. We're all of these people on this call, you all know, like you're more than that. You're more than one bad day at the doctor's office. And I love that part of my job. And I think it's what keeps me passionate about it. My least favorite thing, I would probably have to say kind of the flip side of that coin. When you get to know people so well, you feel a little bit guilty, bad. I don't know how you want to phrase that, but it's a burden. And it's really hard some days to not let things go if something doesn't turn out well. You feel responsible, you feel like maybe you did something wrong, and maybe you did. Unfortunately, we're human, we make mistakes. So that's probably my least favorite part, is knowing at some point either I will or have hurt someone or let somebody down, or maybe just miss something. And it sucks. That really sucks. Nobody wants to do that. You don't go into healthcare so you can be like, oh, what can I screw up today? That's a burden.
Yeah, I'm sure delivering bad news is not one of those favorite things. We have a couple more questions that are coming in. One great question about recertification or a certification exam. Also talk about any and all of the data entry and paperwork that you have to complete.
So first question, certification exam. It recently got better. When I got out of school, you had to take it every 2 years, which sucks. Now you take it, and it's hard. The very first time you take it, it's hard. You have to study and you prepare, for 2 years to take that exam, and then you hopefully pass. And then if you pass, then you have to take so many hours of continuing education every 2-year cycle. So you have 2 years to create so many hours, which you do by reading journals and going to conferences, many times virtually this past year, about just keeping your knowledge up to date. Because depending which specialty you work in, you still have to know the broad general medicine that you were trained when you got out of school. So you still have to know how to take care of men. I still have to pass that type of exam of a general knowledge base. But the recertification exam is now every 10 years, which is awesome. And I think a lot better of a timeline. And then the question about data entry. So like I mentioned earlier, part of my job is to train people on how to use electronic medical record. And it's because a lot of our job is, quote, paperwork. It's not paperwork, it's computer work. So learning to use technology, you young people, you're naturals at it because you've been doing it. You're probably better prepared than any generation ever has been or ever will be to adapt to changing technology with this last year. So you should put that little star on your shoulder. But it's a lot. It's a lot of what we do. You have to document everything. Everything is part of that medical record, and it's a legal document. So you also have to be respective of rules and regulations, and there's a lot of things to know. So it's a huge part of my job. I mean, if I have a clinic hour day, say 9 hours of patients, I can bookend either side of that of about another at least hour of additional time just documenting things. But a lot of that too is because then there's the results that come in and phone calls that come in and messages and emails and all of the things that you guys also do with school.
Excellent. Thank you. I do want to kind of ask you, we've got these students on. So what kind of advice do you have for someone? And again, most of our students are, post-secondary students, but we may have a few on here. But what kind of advice do you have for someone that's looking into going into a physician assistant career?
Yeah, kind of like I had said before, figure out where your passion is by just trying things. I never ever thought I would be in women's health for 18 going on 19 years. I would have bet you $1 million. It is the last thing I wanted to do. And here I am. So you got to try things and you got to go out of your comfort zone and you got to fail at things too. And it's okay to fail. It is okay to not be okay. That is my mantra for 2020. And now we're just rolling it right into 2021 because so much of what's happening right now is just not what anybody wants. And that's okay. That's my biggest piece of advice, to be honest, whether you want to be a PA or not. But also the key takeaway, I think, for a PA specifically, like it's a great career. And I could go on and on about all the things that are great about it. Flexibility being the main one. If you are I get bored doing the same thing, being a PA is pretty awesome because you're not ever stuck. You are stuck being a PA, but a PA can work in any medical area that they would want to. You just got to find the job or create the job. Now, that being said, you're also not the doctor. And so even though many states are moving to more independence for the PAs, not having to have, we don't have to have our chart signed. We don't legally have to do any of that anymore, but there are still ties where we have to have a physician on our team. And if that's not your style, then you should go to medical school because you're not going to be happy if, we're more independent than we have been in 20 years, but it's still what is our name? Physician assistant, right? So I think people have to understand that. Those are the two big takeaways I'd say. And then the third just being, be young, experiment, be safe, but try things and learn from our mistakes.
Great. Just a couple more things that you had mentioned, the supervision piece in regards to physicians, doctors. If you could expound on that, if that has changed in the last 5 or 10 years. And then also talk about, Kim, do you see physician assistants changing, or is there talk of any kind of changing of certifications down the road?
Yes. So first of all, supervision. So PAs are currently still supervised in the state of Wisconsin, but that's not true in every state. Some states, they have what's called the collaborative relationship, which is more in line with what our nurse practitioner colleagues are. And essentially in Wisconsin, PAs and NPs have kind of the same job. We do the same things. We work in the same way. My coworker, Melissa, and our patients don't think we're any different type of provider. In fact, sometimes people think she's a PA and sometimes people think I'm a nurse practitioner, because to the patient and to our physicians and the people we work with, we're the same. But technically, I have a supervisory relationship with the physicians, a legal relationship where there is a physician assigned to my team who supervises me. In the beginnings, when I first came out of school, it was more of that constant, we practiced together. So he and I were at the same place. When I was done for the day, we'd go over charts. He would have to sign a prescription that I wrote. So yeah, it was very tight. And over the last 19 years, that has become less tight. So I have a supervising physician, but she's just available if I need her. She legally has to review some of my charts, but we can decide what that means. It could mean like never officially and just whenever I ask her to, or it could mean so many per month. And that's set by my employer. They want her to review 10 charts per month. So this is a legal relationship. We are moving towards hopefully getting collaboration as our official title, because that's more of what we actually do in practice in most places. And we actually had a bill, and it was all the way approved through the legislature last winter, and then COVID happened and it didn't get its final approval by the Senate to go to the governor's desk. And because of the way politics works, we have to start all over this year. So that will just change the wording legally. And then nationally, there's talk about renaming our profession. It's a long story, but essentially you can imagine why physician assistant is no longer quite accurate to represent what we really do. But there's a lot of pushback in that too, because that's who we are, that's who we've been. So stay tuned on that. Nationally, I'm sure that will be a hot topic, but there's so many other hot topics in the world right now that it's not obviously the highest on the list.
Well, that is good information to know. Do they have a new name? Somebody picked out a new kind of name, and can you?
Yes. So there's several names in the running, and I can't remember what officially the recommendation was. I used to serve on the national, kind of like our body that represents PAs to our national representation, and like who lobbies for us to the government and all that stuff. But I didn't this last year, so I missed the meeting. But they hired a PR firm. So the National Association of PAs hired a PR, public relations firm, spent a lot of money and essentially asked hundreds of thousands of people, like, what do you think about this title? And what do patients think? What do just ordinary Joe Schmoes think? What do PAs think? What do doctors think? What do employers and insurers think? And so they boiled it down to a couple different ones. So interestingly, in Spanish, the translation of physician assistant is not physician assistant. It's physician associate. So it's asociado medical. And it's because of how we practice makes more sense to say physician associate. So that was one of the titles. One of them was, I believe it's medical care practitioner. And that's kind of modeled after the UK. So there are PAs all over the world too, by the way. We started in the United States, but there are PAs in Canada, UK, Australia, Cuba, several countries in Europe. So anyway, it's an international position, but they work very differently in different areas of the world. And I believe it was UK where they decided to call them something different completely.
Well, great. Does anyone, just asking out there, any other questions that are coming in? So I see another one that says, speaking of Spanish, would you say taking a foreign language class would help you get into medical profession programs?
Yes. Without a doubt. While we have at our fingertips translation services, right? I mean, apps and videos and, services that we pay for, and we have hired interpreters because in Green Bay, we have a huge Hispanic population. We also have a large Somali population. But truly knowing any other language as a healthcare worker, whether you're a PA or a nurse or even a person just answering the phone, if you can speak somebody's language, you create trust. You create a relationship right off the bat that says that you care. And I think it looks really well on an application, no matter what you're doing, that you took the time to learn a different language. I mean, that's just an aptitude and an interest that rounds you out. It makes you unique. So always a plus.
Thank you so much, Kim. Anything else that you want students to know? Or I'm going to do one kind of last call out for questions for students, and then we can kind of begin our wrap up.
Yeah, I think my one little piece is, I think what you guys are all doing is great. The more you can do this kind of stuff right now, especially with COVID. I know many of the PA schools are taking that into account. Normally they require quite a few patient hands-on experience, patient care experience, but it's just not easy to get, especially if it's volunteer. However, you can be creative, you can try to figure something out. And that again makes you unique, shows that you have a passion and that you are really interested in doing whatever it is, whether it's PA school or something else that really wants to have that experience. And I would also add that if you ever do hear that, the COVID restrictions have been lifted, the Wisconsin Academy of PAs, which is our state society, always has PAs throughout the state who take students to shadow. So you can always reach out through there if you're looking to make a connection.
Well, Kim, I cannot thank you enough for all of this really great information about physician assistants. It was great to see you. I'm certainly going to turn it over now to Candace to kind of finish up our event. Thank you.
You're welcome. Thank you.
Yes, Kim, thank you so much. Such great information. Students, I hope you found that as useful, even as I did, not knowing as much about this profession. And we really hope that you will tune in to some of our future healthcare sessions. Thank you so much.